My name is Sam Underwood. I'm a practice educator here at Langdon Hospital and a registered mental health nurse as well. I come from a family of nurses and healthcare practitioners, so my mum was a nurse and her mum was a nurse as well, so I think it's kind of in my DNA, as it were. As with a lot of people who work in mental health, I had my own experiences as a teenager of having difficulties with my mental health, and I think I wanted to do something that at the end of my career that I'd done something worthwhile. My role as a practice educator is to primarily support the development of practice. We support the learners on site, so the preceptee nurses, the nurses that have just qualified. We support their transition from a student to a qualified nurse. Having that support and that anchor is really important. We also do educational programs on the ward. It's a mix of on-the-ward clinical activity and role modelling alongside kind of classroom-based teaching. We have a preceptorship program, so every week we deliver different sessions. We work shifts with them once a week, so it's just really about building their confidence and that they know that I'm there just for them. For me as an educator, being able to see my colleagues fulfil their ambitions and their potential as well is really rewarding. I take more pride in that than my own achievements in a way, because it's so nice to see them fulfil what they want to do with their career. It's really lovely. Being in mental health and being a mental health nurse, your team is everything. Working with my team enables me to be the best nurse that I can be. The teamwork here at Langdon in particular and in DPT in general is just so empowering and enabling for nurses. The most rewarding part is seeing the patients have a second lease of life. I just find that I never get bored of that. I don't think I ever will get bored of that. I love the challenge. I love that it's ever changing. No two patients are the same. And I think people with mental health problems are generally stigmatised and often ostracised from their communities. And people who have come into contact with the criminal justice system are also ostracised and also stigmatised for their past. And so you combine the two together and you have some of the most isolated people in our community. And being able to be a support network for that person at that time and be a positive influence on their life is just an absolute gift, I think. And just being able to be that listening ear for someone when maybe they haven't had that in the past and no one has taken the time to just listen to their story and ask them how they are. So yeah, I think it's a real privilege. I grew up in Somerset, so I love the countryside, and being in the southwest and the quiet. I met my partner and moved to Devon after I finished uni. I love the quiet and the feeling of calm when you're outdoors. I think doing a job like we do, it's really important to have that place. Being able to drive and be by the seaside in 10 minutes and be on the moors in 10 minutes is an amazing gift that we get. I love the sense of community down in Devon. I can't imagine living anywhere else other than Devon in the southwest.